Nursing Research by Melina Chouinard, Becca Busby, CJ Hare, and Celeste Fortier. In this presentation, we'll talk about why research is important in nursing practice, the connection of research to theory and practice, differentiating qualitative and quantitative methods, identifying the components of a research study, and understanding terminology and how to read research. To begin, what is evidence-based practice? It's a continuous, interactive process involving the explicit, conscientious, and judicious consideration of the best available evidence to provide care. It's essential to optimize outcomes for individual clients, healthy communities, and to improve clinical practice, achieve cost-effective nursing care, and ensure accountability and transparency in decision-making within the healthcare system. This was defined by the Canadian Nursing Association in 2015. So, why evidence-based practice? It's to help you make accurate, timely, appropriate decisions to ultimately improve patient care. The connection between theory and practice to research is that without research, neither of these exist. Research has discovered, tested, and enhanced nursing practice as a whole. Using research is proven to greatly improve patient outcomes, keep costs down, and it challenges nurses to keep up to date with theory to gain understanding and knowledge. Now for qualitative versus quantitative methods. Qualitative methods consist of precise investigation, not using numbers, therefore data like definitions, meanings, and descriptions. Quantitative methods are specific numbers and statistics, such as temperature change. The components of a research study. There's the abstract, which is a basic overview of what the research involves. The introduction, which demonstrates the process in which the research will be conducted. The literature review or background, which is seeing if there's any prior knowledge or data and implementing it towards educating the lector. The manuscript narrative, which is the meat of the study, the middle component containing most of the information. The purpose statement, which is the reason why the research is being conducted. The results, which are a short summary of the research's findings. And finally, the clinical implications, which is basically explaining if there's anything you'll need to do in your practice. Now for an overview of the steps of doing research. There are your specific aims, which identify and develop your topic and see how it relates to clinical practice. Then find background information, review related research and other works in the same field. Hypothesis. So develop a theory that describes the problem, the contributing factors, and possible solutions. Research design. Begin the methodology of a specific research design for your study. Setting and sample size. Describe the characteristics of the setting where the proposed research project will take place. The size, the nature of the research sample, and how the sample was selected should also be described. Measurement tools and coding strategy. State tools or instruments to be used to measure the study variables and define a coding strategy appropriate for the examination. Final step in research is to analyze the data, interpret the results, describe clinical significance, present peer review, incorporate review results, and pick apart the research findings. So how to read journal articles efficiently. Start with the abstract. It's a summary. Then jump to the discussion, another summary. It will let you decide if you want to use this article. Then go back to the intro and start over. This shows the author's approach on the study. The body will include methodology, results, and data. Reread to catch things you may have missed the first time. And question yourself after reading. Ask yourself, what's the topic? What do I already know about this topic? Do I agree? And does the author agree with other researchers? Understanding or comprehending what you read will help you think critically on the topic. In conclusion, evidence-based practice helps nurses make accurate, timely, appropriate decisions to improve patient care. Qualitative research is numerical, whereas quantitative research is numerical. The components of a research study are the abstract, intro, review, narrative, purpose statement, results, and clinical implications. The steps of a research study include specific aims, background information, hypothesis, research design, setting and sample size, measurement tools and coding strategy. And to read efficiently, start with the abstract, then discussion, go back to the intro, read through the body, reread the article, and question yourself. This concludes our online component of nursing research. Thank you for listening.